So we've got a clinical case, my beloveds. Let's go, let's start. Take your pens, papers, and be careful, huh? So, 72-year-old man is brought to the emergency department with a sudden onset of a right-sided weakness and inability to speak, which started 1 hour ago. His vital signs are blood pressure 195, 110 mercury, 1911 mercury, heart rate 88 beats per minute, RR interval 18, respiration, O2 oxygen is 98% saturation. Saturation 98. A non-contrast head computer tomography is immediately performed and shows no evidence of hemorrhage. Great. The neurology team confirms an acute ischemic stroke with an National Institute of Health Stroke Scale, NIHSS, of 15 and wishes to administer intravenous alteplase. Okay. TPA, alteplase, it's a TPA. Which of the following findings from the patient's history is an absolute contraindication to administering thrombolytics in this patient? Actually, good question. History of hemorrhagic stroke 5 years ago, definitely. It's absolute contraindication. His current blood pressure 195, 120, 10, relative. But absolute is a history of hemorrhagic stroke. And NIHSS, National Institute of Health Stroke Scale, score greater than 5, no. History of anaphylactic reaction to iodinated contrast dye. So actually, correct option is a history of hemorrhagic stroke. The decision to give a thrombolytic, what is thrombolytic? Clot buster, right? Is a high stakes balance between the benefit of restoring blood flow and the risk of causing catastrophic bleed. So why this option is correct? A history of any prior intracranial hemorrhage, that is hemorrhagic stroke, at any time is one of the most important absolute contraindications to thrombolytic therapy, my beloveds. The risk of causing a new severe bleed in a brain that has bled before is unacceptably high. Next, why other options is incorrect? About blood pressure. While a blood pressure greater than 185, 110 millimeter mercury, it's a contraindication, but it's a relative and treatable one. In this scenario, the clinical team would immediately administer intravenous antihypertensive, like nicardipine, labetalol, depends, to lower the blood pressure below the threshold, and then they could safely administer TPA. It doesn't permanently exclude the patient from treatment. So high blood pressure is just relative contraindication and temporary contraindication, actually. About National Institute of Health score. A high NIHSS, National Institute of Health stroke score. High score, in this case is more than 5, indicates a more severe stroke. This is an indication from thrombolytic therapy and not a contraindication at all. These are the patients who stand to benefit the most from reperfusion therapy. So this is not. History of anaphylactic reaction. So an allergy to iodine, iodinated, next to last option, An allergy to iodinated contrast dye is a contraindication for a computer tomography angiogram, CTA, or other contrast-enhanced studies. It has no bearing on the administration. There's no bearing on the administration of intravenous alteplase, which is a completely different medication at all. Absolutely. So history of any prior intracranial hemorrhage, that is stroke, hemorrhagic stroke, is at any time is one of the most important absolute contraindications to this 72-year-old man for thrombolytic therapy. Good? Great.